Have you ever taken off your socks at the end of the day and noticed a deep ring around your ankle, a mark that lingers for minutes or even hours after your socks are gone? Most people look at it, shrug, and move on with their evening. But what if I told you that simple sock mark could be one of your body's most overlooked warning signals? What if that ring around your ankle is your body quietly screaming that something is wrong? Something that has nothing to do with your socks being too tight? Stay with me through this entire video, because what you're about to learn could genuinely save your life or the life of someone you love. Let's start with something that sounds almost too simple to be serious. You put on a pair of socks in the morning, normal socks, maybe not even tight ones. You go about your day, work, errands, sitting at a desk, walking around the house. Then at night, you peel those socks off and see it. A groove, a deep indentation, a mark that wraps all the way around your ankle like a rubber band was pressed into your skin all day long. You probably thought, these socks are just too tight. But here's the thing, the sock isn't always the problem. Sometimes, and this is where it gets important, that mark is caused by something happening beneath your skin, something in your circulatory system, something that could be quietly putting your heart at risk right now. And millions of people have no idea. Let's talk about what's actually happening when that mark appears. Your legs are constantly working against gravity. Every single day, your veins are responsible for pushing blood upward from your feet, your ankles, your calves, all the way back up to your heart. It's a long journey, and it requires pressure. When everything is working correctly, your vein walls are strong and elastic. Tiny valves inside those veins open and close in a rhythm, pushing blood upward, preventing it from flowing backward. Your leg muscles help too. Every time you walk or move, those muscles squeeze around the veins and act like a pump. But when something goes wrong in that system, blood begins to pool. It collects, it stagnates, and as it does, fluid starts leaking out of the blood vessels and into the surrounding tissue. That fluid has nowhere to go. It accumulates in the soft tissue of your legs, your ankles, your feet. This is called edema, swelling caused by fluid retention. And when you put socks on legs that are retaining fluid, the elastic band of those socks compresses the swollen tissue. And when you take them off, the mark stays behind, sometimes for minutes, sometimes for hours. The sock didn't cause the mark. The mark revealed what was already there. Now here's where I need you to really pay attention. Edema in the legs and ankles, the kind that causes those sock marks, can be a symptom of several underlying conditions. Some of them are relatively minor. Some of them are life-threatening. Let me walk you through the most important ones. The first, and the one that concerns cardiologists most, is congestive heart failure. I know that sounds dramatic. I know you might be thinking, I would know if my heart was failing. But the truth is, many people with early or moderate heart failure feel relatively normal during rest. They get a little more tired than they used to. They notice some swelling in their legs. They might feel slightly short of breath when they climb stairs or carry groceries. And they attribute all of it to aging, to stress, to being out of shape. Meanwhile, their heart is struggling. In congestive heart failure, the heart isn't pumping blood as efficiently as it should. Blood backs up. The pressure in the veins increases. The kidneys begin retaining more salt and water, a response the body triggers when it senses the heart isn't delivering enough blood, and all that extra fluid has to go somewhere. It goes to the legs, it goes to the ankles, it goes to the feet, and you see it as swelling, as that stubborn mark left behind by your socks. This is not a rare condition. Congestive heart failure affects millions of people, and one of the most common presentations, especially in the early stages, is bilateral leg swelling. Swelling in both legs, both ankles, that mark on both sides when you take your socks off. But heart failure isn't the only explanation. Let me give you the full picture. The second major cause is chronic venous insufficiency. This is when the valves inside your leg veins stop working properly. Instead of pushing blood upward efficiently, those damaged valves allow blood to flow backward between heartbeats, called venous reflux. Blood pools in the lower legs, pressure builds, fluid leaks into the tissue. Chronic venous insufficiency is extremely common, especially in people who spend long hours standing or sitting, people who are overweight, people who have had pregnancies, and people with a family history of vein problems. It won't kill you the way heart failure can, but it's not harmless either. Left untreated, it can lead to painful varicose veins, skin changes, and eventually venous leg ulcers that are incredibly difficult to heal. And importantly, people with chronic venous insufficiency often also have cardiovascular risk factors that need to be evaluated. The third major cause of ankle swelling is kidney disease. Your kidneys are responsible for filtering your blood and regulating fluid balance. When kidney function declines, whether due to chronic kidney disease, diabetic nephropathy, or other conditions, the kidneys begin retaining sodium and water instead of excreting them. That excess fluid has to go somewhere, and it tends to settle in the lowest parts of your body, your ankles, your feet, the areas that leave those marks when your socks come off. Kidney disease often progresses silently. Many people don't realize anything is wrong until a significant portion of kidney function is already lost. The swelling may be one of the only outward signs. Fourth, liver disease. The liver produces albumin, a protein that helps keep fluid inside blood vessels. When liver function is compromised, albumin levels fall, and when there isn't enough albumin to hold fluid in the vessels, it leaks out into the surrounding tissues. This is called hypoalbuminemia, and it's a serious condition. It's associated with liver cirrhosis, severe malnutrition, and other conditions that require prompt medical attention. Fifth, medications. Here's something that surprises a lot of people. Several very common medications can cause ankle swelling as a side effect. Calcium channel blockers, used to treat high blood pressure and heart conditions, are among the most frequent culprits. Amlodipine, nifedipine, and similar drugs can cause significant ankle swelling in some patients. NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen, can also cause fluid retention. Certain antidepressants, steroids, and diabetes medications are on the list too. If you're taking any of these and you've noticed sock marks becoming more pronounced, that conversation with your doctor just became urgent. Sixth, deep vein thrombosis. This one is potentially life-threatening in a different and immediate way. A DVT is a blood clot that forms in one of the deep veins of the leg. It typically causes swelling in one leg, not both, along with warmth, redness, and sometimes pain. But not always. Some DVTs are nearly silent. Why is this dangerous? Because if that clot breaks free and travels through the bloodstream to the lungs, it becomes a pulmonary embolism, a blockage in the pulmonary arteries. This can be fatal within minutes. If you have swelling in only one leg, especially if that leg also feels warm or looks red or feels heavier than the other, do not wait. That is a potential emergency. Now, I want to pause and ask you something directly. How long have you been noticing those sock marks? A few weeks? A few months? Maybe longer, but you've just never thought much about it? That's the thing about these warning signs. They don't come with sirens. They don't come with sudden dramatic symptoms that make you feel like something is clearly wrong. They creep in slowly. They become part of your routine. You normalize them. You think, I've always had a little swelling at the end of the day. It's just how my body is. But bodies don't randomly retain fluid without a reason. There is always a physiological explanation. And some of those explanations need to be found and treated before the window of intervention closes. Let me tell you about the difference between swelling that's concerning and swelling that's more benign, because not every sock mark is a cardiac emergency. Here are the signs that suggest your swelling is more serious and needs prompt medical evaluation. The swelling is getting progressively worse over weeks or months. It used to be mild at the end of the day. Now it's there in the morning when you wake up too. The swelling is in both legs equally. Bilateral swelling, affecting both sides, is more often a sign of a systemic issue: heart, kidneys, liver, or a medication effect. You've also noticed that you're more easily fatigued than you used to be. Activities that used to feel normal now leave you winded or exhausted. You've noticed you're sleeping better propped up on pillows, or that lying flat makes you feel uncomfortable or short of breath. This symptom, called orthopnea, is a classic sign of heart failure. When you lie flat, Fluid redistributes from your legs toward your chest and lungs. A healthy heart handles this easily. A struggling heart cannot. You've gained weight rapidly without a clear reason, a few pounds in a few days. This is often fluid retention and is taken very seriously in cardiology. You've noticed your urine has become foamy or darker than normal, potential signs of kidney involvement. Your abdomen feels bloated or distended in addition to leg swelling, possible liver involvement. You've noticed your heart racing, pounding, or feeling irregular. You have chest discomfort, even mild or occasional. If you have any combination of those signs alongside your sock marks, please don't finish this video and go back to your normal evening. Make a phone call, get an appointment, do something about it today. Now let's talk about what actually happens when you go to a doctor about ankle swelling. A good evaluation will start with a detailed history. When did this start? Is it worse at certain times of day? Is it in one leg or both? Are you short of breath? Have you noticed any weight changes? What medications are you taking? Then comes a physical exam. Your doctor will press on the swollen area. They're checking for what's called pitting edema. This is when you press your finger into the swollen tissue and the indentation stays behind for a few seconds after you remove your finger. That tells the doctor the swelling is caused by fluid, not fat or lymph tissue. They'll listen to your heart and lungs. Fluid can accumulate in the lungs too in heart failure, producing a characteristic crackling sound called rales when you breathe. They'll check your neck veins. Elevated jugular venous pressure, visible distension of the neck veins, is one of the most telling signs of heart failure on physical exam. Then come tests, blood work to check kidney function, liver enzymes, albumin levels, electrolytes, a BNP or NT-proBNP level, a biomarker released by the heart when it's under stress. If this number is elevated, it strongly suggests cardiac involvement. An ECG to look at the heart's electrical activity. Often an echocardiogram, an ultrasound of the heart to directly assess how well the heart is pumping and to look at the valves. Sometimes a Doppler ultrasound of the legs to rule out deep vein thrombosis. This is a thorough and systematic process, and it's exactly what your body deserves when it's sending you a signal. I want to address something that I know some of you are feeling right now. Maybe you're a little scared. Maybe you're thinking about those sock marks you've been ignoring for months, and suddenly they don't seem so trivial anymore. Or maybe you're in the other camp, skeptical, thinking I'm being dramatic, thinking lots of people have swollen ankles and they're fine. And you're right, lots of people do have swollen ankles, and many of them have benign explanations. Long days on their feet, hot weather, too much sodium, flying on a plane, pregnancy. But here's the question you have to ask yourself honestly. Do you know which category you're in? Or are you just hoping you're in the benign category because the alternative feels uncomfortable to confront? Because the only way to know, the only way to stop guessing and start knowing, is to get evaluated. And the people who get evaluated, who find the problem early, who start treatment before significant damage is done, those are the people who get to keep living their full lives, who get to be there for the people they love. Let me give you something practical. Here are the steps I want you to take right now, or at least this week. Step 1, pay attention to your sock marks with intention for the next 7 days. Is the swelling there in the morning when you wake up, or only at the end of the day? Is it in one leg or both? Is it getting worse? Start noticing instead of normalizing. Step 2, press your finger firmly into the swollen area for about 5 seconds, then release. Does the indentation stay? That's pitting edema. Note it. Step 3, weigh yourself every morning at the same time before eating or drinking. Rapid weight gain, 2 or 3 pounds in a day or two, can indicate fluid retention and is a legitimate reason to call your doctor that same day. Step 4, notice your breathing. Are you more winded than usual? Do you feel more comfortable sleeping on extra pillows? Do you feel a strange pressure or discomfort in your chest, even occasionally? Step 5, make the appointment. Call your doctor. Tell them you've noticed persistent ankle swelling and you want it evaluated. You don't need to have a dramatic symptom to justify a conversation with a medical professional. Persistent unexplained swelling is enough. Here's something that most health videos won't tell you, but I think you deserve to hear it. The heart gives warnings before it gives emergencies. Heart attacks and strokes and pulmonary emboli don't usually come out of nowhere. The body signals distress for weeks, months, sometimes years before a crisis moment. But those signals are quiet. They're easy to rationalize, easy to ignore, easy to attribute to something benign. Sock marks, fatigue, a little more breathlessness than before, waking up in the night, swollen ankles that you write off as just one of those things. The people who catch heart disease early, who get treatment before a cardiac event, are often the people who paid attention to those quiet signals, who didn't dismiss them, who brought them to a doctor and said, "Something feels different. I want to understand why." You have that same opportunity right now. Before I go, I want to say something directly to you. I don't know your specific situation. I don't know your age, your history, your other symptoms. I'm not your doctor, and nothing in this video is a substitute for a real medical evaluation. But I do know this. You watched this video for a reason. Something brought you here. Maybe you've been noticing something that felt off. Maybe someone you care about has these symptoms, and you wanted to understand what they mean. Whatever brought you here, trust that instinct. Your body is not random. It communicates. And when it leaves a mark on your skin every single night, a mark that lingers long after the sock is gone, it is trying to tell you something. Listen to it. If this video opened your eyes to something you hadn't considered before, if you learned something that you're going to share with someone you love or act on yourself, then I have one simple ask. Hit that subscribe button right now. Every week on this channel, we bring you information like this: real, evidence-based, medically grounded content about the signals your body sends, the ones that are easy to miss, the ones that matter, the ones that could make a genuine difference in your health and the health of the people around you. We don't do sensationalism. We don't scare you for no reason. We give you the truth, and then we give you what to do with it. The subscribe button is right there. It costs you nothing, and the next piece of information you get from this channel might be the one that matters most. Subscribe. Share this video with someone who needs to hear it, and take care of your heart, because it's been working for you every single second of your life without stopping. It deserves the same attention in return.